you used a very specific word there of fear, right? And I think fear is the key component to all of this, right?
Sure.
If you're in a fearful state, you're in an anxious state, you're going to be more cautious, right? And this idea of being cautious leads to hesitancy.
Sure.
And when you're hesitant,
That's when accidents happen.
that's when accidents happen, right?
Hey everybody, welcome to another episode of the Doc Jock Show. I got my friend here, Matt, and he is, man, like you have so many credentials behind your name. You work with the Olympics, you have your own program, you're training physical therapists as well. Why don't you dive into that a little bit? Tell everybody a little bit about what you do before we dive into whatever the heck we're going to talk about today.
Oh, geez. You know we're going to go down so many rabbit holes with all this stuff too.
Let's do it. I have a secret weapon too that somebody armed me with, a very reliable source. So I'm going to wait to drop it in at some point.
Oh, you are?
Yeah, so we'll see.
Secret agent.
Yes.
I'm going to have to figure out who that is later.
Yeah, it's a double agent.
Oh, God. Uh-oh. Yeah, well, my name's Dr. Matthew Zanis. You left out the doctor.
I apologize about that.
Yes. It's okay. Yep. It's all right. I joke all the time. I have like alphabet soup after my name. There's actually more letters after my name than in my name now.
There you go.
But ironically enough, nobody really gives a shit about that.
Yeah.
Which is kind of cool, right? All I really care about is, am I going to get you better?
Yeah.
Yes or no? All right. But yeah, so I am a doctor of physical therapy. I'm a human movement specialist and strength conditioning coach. And I'm really just kind of like a backwoods boy from northeastern Pennsylvania, right? I grew up in the anthracite coal region of PA, so real down to earth, salt to the earth kind of guy. Yeah. And that really shows up, I think, in my practice and in the authenticity of what makes me me, which I think is what helps people kind of connect with me in a different way, which is kind of cool.
Yeah, you're a lot more grounded than most other people.
Well, I am a Taurus Capricorn as well, so it's a lot of earth energy.
I'll have to learn more about that.
Yeah, you have to learn about your astrology and numerology.
Very
Doc. But I actually got my start way back when growing up in Pennsylvania. Kind of grew up playing baseball. Did a lot of different sports growing up. Problem is that I sucked at most of them. I'm what they call really a genetic trash can. Okay. Yeah, so I just didn't really have the innate kind of genes that my parents did. They were both collegiate athletes. Yeah. I got some semblance of that. Sure. The problem is that I couldn't live up to those expectations. And I really had a strong work ethic, which is kind of like what got me by, so to speak. But every year I would just kind of work harder, practice more, throw more. I was primarily a baseball player and just kept getting hurt all the time until I found weight training in high school. Okay. And that was kind of like the pivotal turning point for me, because it's when I realized, oh shit, I'm a way better coach and athlete and a way better practitioner than a player. Yeah. Huge turning point, right? Yeah. So then I kind of shifted gears and kind of threw all the athlete stuff away, decided that I was going to help people become better athletes and better movers. And that's really where it took off for me when I went to University of Pittsburgh, got my degree in athletic training, and then worked with the Pittsburgh Pirates organization for a little bit, and then went down to Duke in North Carolina, where I got my doctorate, and then did an orthopedic residency and manual therapy fellowship, which is where all those letters kind of come full circle after the name. Yeah. But going to Duke allowed me to mentor and train under a bunch of different practitioners and physical therapists and coaches, which actually brought me out here to Arizona to have an internship with the Arizona Cardinals. Fell in love with the area, decided I didn't want to shovel snow anymore. And I haven't looked back. I've been here for 8 years now.
That's awesome.
Been a beautiful turning point for me.
Yeah, and a fun fact. I don't know if I told you this or not. Obviously, for those of you who are watching, they know I'm from Pittsburgh as well. But
we connected on it.
That's one of the things that brought us together. And then something on top of that was my dad actually grew up by the anthracite. I don't know, coal. Is it coal? Yeah,
it's coal.
And he bought us anthracite coal for Christmas. Because we didn't come. It? Yeah. Well, he found it. Yeah. Found it, sent it to us because he was mad at us for not coming back for Christmas.
Oh, so you got coal in your stocking.
I got coal in my stocking. Yeah.
Let's see how that works.
Yeah. I opened it prior to Christmas. So I was like, what the fuck? Listen.
Yeah. I was like, my grandfather was a coal miner. He got that shit for free.
For free. Yeah. Yeah. For breaking his back, probably.
And we did get all coal for Christmas sometimes too. Oh, yeah.
I guess it's
kind of like a joke present in the stockings. Always showed up and parents loved to fuck with us. It was great.
Nice. Yeah. Oh, well, side note aside. Yeah, let's dive in about, let's talk, because you do a lot of movement work. You do a lot of, especially on like Instagram and stuff. Talk to me. So you were a poor athlete. You I mean, call a spade a spade. You weren't the best athlete.
Mediocre. Let's
You're
go
mediocre. Okay. Mediocre athlete, not abysmal, not terrible, not painful to watch. Sometimes, maybe depends on what the sport was.
Right.
But from there, what are the keys, tips, and tricks that you've learned along the way with what you've probably have seen most athletes struggle with in terms of movement?
Oh God, there's so many things. For me though, what I learned throughout all my different injuries is that they're lessons.
Okay.
Right. So each injury was a new way for me to learn about my body and what the pain meant, where my limitations were, and then where I needed to improve. And that was kind of all like setting the stage foundation for me to kind of help other people moving forward. But I think the greatest limitation with athletes I work with from all levels, from the high school age all the way up to the Olympic athletes I work with USA Shooting. So the shooting team is my primary primary group of men and women, which I love that fucking community. They're so cool. Is this idea of like conscious awareness. I know that sounds kind of weird and esoteric because like hearing a movement guy, not even talking about anything physical.
Right.
It's more so psychological and mindset in nature, but it's really true. Like the awareness piece is key. If you're not aware of what's going on inside your body, you're not attuned to it, like this idea of attunement. You can do one thing by making up stories in your head of what's going on, which kind of sends you down a whole pathway, usually of negativity and like worst case scenario. Yeah. I know we've all been there before. I totally can tell so many stories about that. And then the other piece of it is you don't know where your blind spots are.
Right.
Right. And if you can't feel into where those blind spots are, you're not aware of them. How could you ever know where you needed to improve? Sure. And I use this term called movement literacy. Okay. So, literacy, obviously your ability to read, write, and communicate. Yeah. Well, we have to be able to find those gaps in our movement literacy to make that fuller so you can express more, which comes in the terms of athleticism and pain-free movement. Sure. Yeah. So it's really about building confidence is what it comes down to. Yeah.
I mean, I've played sports, obviously I've worked with some athletes and stuff too. The mindset is the biggest of all things. And it's the ability to be able to perceive what it is around you, but also like that proprioception piece where you need to know where your body is in space. And if you don't know where your body is just at all, or you don't know how to properly move, then you're going to be more prone to injury.
Mm-hmm. How do you define athleticism? I'm curious.
Probably a different definition, but athleticism, I would say more. If I had to just be put on the spot because I am right now.
You're welcome on your own podcast.
Athleticism, I would say the ability to be able to either pick up a sport or play a sport with like effortless ease without injury.
I would agree with that. I think that's there's definitely a lot of merit to that definition. And there's one that I use. I asked you this question because you mentioned the term proprioception. Sure. And that falls within my definition of athleticism. Okay. And this definition is actually not mine. It's John Wellborn, who's the CEO of Power Athlete. He came up with this, wrote it out on a napkin one day instead of a coffee shop, kind of like the one that we're in now. Yeah. And it's the ability to seamlessly and effortlessly combine primal movement patterns through space to accomplish a known or novel task. Yeah. So that's kind of fitting, like what you said. Sure. Pick up on a sport and be able to play that, or a movement pattern and be able to express it. And this idea of seamless and effortless movement is that proprioception and that kinesthetic awareness. So knowing where your body's at in space without really having to think about it, right? Because the most athletic people make it look really easy, right? You're kind of joke with me about being a poor mover and it looking bad. Sure. When you see shitty movement, it's pretty obvious, right? When you see beautiful movement, it's also really obvious, right? We just had a big event called the Super Bowl a few weeks ago. How many times do you see like a wide receiver kind of running down the sideline, staving off defenders, trying to stay in bounds while catching a long ball from the quarterback without even looking over his shoulder? Like, bloop, pops right in,
like nothing.
Touchdown. Like nothing. Think about everything that is going on right there in that moment. If he had to think about any of it, wasn't going to be successful in that play, right? That's where you see movement start to break down. Maybe he doesn't know where his footing is, and that's where you can tear an ACL. Or the defender comes in and blocks the ball. Right? So you need this seamless and effortless movement, which actually can be trained in the gym. And that's kind of the dichotomy that I think people have a hard time grasping, is that we talk about this idea of sports specificity a lot, right? And you see all the time out there with people trying to promote these sports-specific training programs, which literally look like, I mean, you've seen this, like, let's just throw a ladder out and have you do all this fast feet work down the sideline, right? Or it just looks like a bunch of conditioning drills or running with resistance bands, somebody holding the band, or like maybe those parachute things,
Yeah.
all that, like these speed camps. Believe me, I've been through it myself.
Yeah,
Remember
me too.
backwoods Pennsylvania, right?
Yeah.
We didn't have much. We were really gullible.
Yeah.
We took anything that came on our plate, right? And that type of training doesn't translate into athleticism, right? What you do in the gym has a correlation to it, right? But it's not sport-specific training. Sport-specific training is done on the field. Like you're just practicing and you're doing your skill, and you're getting better at it by quite honestly failing, right? Yeah. And learning from those mistakes. Quite like all the injuries that I sustained growing up, I had to learn from those mistakes as well. It was all great information, but we can use those primal movement patterns that I spoke of, train those in the gym. And now we set the stage, right? Now we can break every type of movement pattern down into its component parts, which is kind of like the chunking method of education, right? You learn letters to make words, words to make sentences, sentences make paragraphs, and paragraphs then develop into these stories, right? Sure. Same thing with movement. We could take a movement pattern like a squat, break it down to its component parts. Okay, what do we need? We need ankle dorsiflexion, knee flexion, hip flexion, external rotation, maybe maintaining an upright trunk. And then we could use those component parts to then rebuild the movement pattern that they could use to express different qualities like strength, power, speed, that is then going to be translated onto the field, the court, the pitch, which is that full movement literacy. It's a story that they're using to express their movement. Right. I do the same exact thing when people come to me in pain. Okay. It's like, all right, well, let's take a look at you. Let's watch you move. What is your nervous system's baseline program for how it wants to move your body? Yeah. And that's kind of what my superpower is this idea of like pattern recognition, right? Yeah, I've seen so much over the 12 years of doing this now. I've seen so much of this that I can pick up on these limiting factors and these common patterns that we see develop in things like unilateral low back pain or shoulder pain, depending on the area, in conjunction with that individual's past history and their training programs that they followed over the years, maybe different sports they played, or even how they were brought up, right? Sure. Culturally, environmentally, like where they grew up, what was their perception and belief system around pain? Yeah. Like I can't even tell you how many times I work with younger kids now that really don't understand the difference between hurt and being injured. Yeah. It's crazy. It's like, you're just sore, buddy. Let's get over it now. It's like, let's stop being
I'm just thinking, just a prime example, but
no, go ahead.
Our son, he cries about everything, and we're getting everything prepped for installation or whatever today, and he's crying. I'm like, oh my gosh. I'm like, this freaking kid, like, he cries about everything. So I'm walking down the stairs, and he's just looking at me with blood coming down his face. I'm like, all right, this one time that you were serious, I
legitimate
did
injury.
not take you serious. All right, cool, perfect. Time to get that fixed. Yeah. But so
you can use that to then, well, the whole pain thing is another conversation. Maybe we'll dive into that a little bit later. But we could take somebody who's in pain like that and break down the movement patterns in the exact same way. Yeah. And when we're working with pain, figuring out how the body has been moving, and then essentially doing something as simple as doing something different, giving a different stimulus in the nervous system, is the best thing that you could do for that individual, right? Because then it helps calm down the nervous system. And then we can start to rebuild, right? To start to put in those component parts that helps them express more movement variability. Okay. And that's kind of the key towards injury pain management and also improving athleticism. Sure. How many more movement options do you have? Right. That's kind of, we've been talking about definitions, my definition of mobility. Okay. Because there's really nothing that irritates me more when I see all these ridiculous mobility flows on Instagram. It's one of my pet peeves. It drives me absolutely nuts. Yeah. It's like, I understand what you're doing, but can you please just go into PubMed and search what mobility actually is defined as in the literature? Because it's really just your ability to get from point A to point B. Yeah. It's not how much flexibility that you have, right? Yeah. How much more hip rotation you could have, right? And it's really defined as how you get from point A to point B. It's why we have these assistive devices known as mobility aids, like crutches and wheelchairs and walkers and all that. And that's where my definition comes in. It's like, okay, well, how many more movement options do you have in your arsenal that can get you from point A to point B? Because if you have more movement options, you get stuck in a sketchy position or situation or context, you have more available to you to potentially come out of that unscathed, not hurt yourself. And my favorite example of this is like, if you look at a power lifter. Okay, so power lifters who train the sport of power lifting, super strong motherfuckers, right? Oh, yeah. Okay, they can handle a lot of load. Sure. When they pick 1,000 pounds up off the ground, does their back look completely straight? No. It rounds. Yeah. Okay. And what do you think they have to do from a training standpoint when they have to prepare their body to lift that amount of load. You have to train near that maximal effort, right?
Sure.
There's a lot that can go wrong there.
Oh, yeah.
Right? And if you get yourself into a position where you go to pull heavy load off the ground, or maybe it's in an awkward position and you're kind of twisting because life isn't really built in this
linear
box, right? Shit can go wrong.
Yeah.
You do have to twist. You do have to manipulate your body. Maybe you got to pick it up off of a deficit. Shit's going to start to move differently.
Yeah.
So are you prepared to handle it?
Sure.
Yes or no, right? So how can we then train your body in a way that gives you these more movement options so that should you get stuck in that position or something does happen to go wrong, you can handle it?
That also plays into the mindset piece too, where if you know, so like if you're tightrope walking, right? And you're like, oh shit, I'm tightrope walking, and you don't have a parachute, you're like, okay, a lot of things can go wrong. You're more than likely going to get in your head, at least as an amateur.
Sure.
If you had a parachute, you're going to be a little bit more confident knowing that if shit hits the fan, you can pull the ripcord and go in a different direction and not die or get injured. So that's like the first thing that popped into my head in sport is like, because like the deficit, and I have a friend, Elliot, who I destroyed his back. Yeah.
Because of HIPAA, we're not going to go into that. But
Right.
We love you, Elliot.
Yeah, we love you. But yeah, so I mean, there's so many people that will do that, and I know that there's like in a bodybuilding world, I think it's Jose Raymond was his name. He's a 212 Olympic competitor, but he wouldn't do deadlifts from the ground anymore. He would only do rack pulls because he was afraid of going down and seeing too many athletes get injured pulling weight from the ground. So when you're powerlifting and you know you've got 1,000 pounds and you're like, or you're doing a strongman, you're pulling a freaking Mack truck, like, and you could step on a little itty bitty pebble and it totally changes your foot positioning, and boom, you could pull anything. But a question that I have to follow up with that is, do you see or have you seen in the past the same weaknesses continue to play in on that? So like say somebody has a hamstring, they pull a hamstring. From my experience, everyone always, after a pulled hamstring, is like, oh, I got a bum hammy. Like, I got to take it easy on my hammy. My hammy's bad. I can't run on my hammy. Do you feel like that's a legitimate thing? Or do you feel like that's another way where you only know one form of the mobility? You need to learn a new way or a proper way to heal that?
Oh, there's a lot that's going on there. It's a very complex question.
Yeah.
You brought up, you used a very specific word there of fear, right? And I think fear is the key component to all of this, right?
Sure.
If you're in a fearful state, you're in an anxious state, you're going to be more cautious, right? And this idea of being cautious leads to hesitancy.
Sure.
And when you're hesitant,
That's when accidents happen.
that's when accidents happen, right? So now if we say we have a athlete, or maybe even like a sprinter, if we want to use that type of example, because that's when hamstrings typically go on somebody, myself included. I used to pull my own left hamstring all the time until I figured out that it was my foot that was causing the problem.
See,
Going back to the source,
Yep.
we'll get there. Yep. You become super fearful of it and cautious and hesitant, and then you start overthinking.
Yeah.
And become over analytical. And it's this idea of like paralysis over analysis, right?
Yeah, sure.
So, paralysis by analysis.
Yep. Yeah.
It's been a long week.
It's all right,
It's been
man.
a long week. So
Trust me, I'm
paralysis
right there.
by analysis.
Yeah.
Where we go back to the idea of athleticism. That's not seamless and effortless.
Yeah.
They're overthinking it. They're too cautious. They're too hesitant. And it's because of that root fear they have of feeling pain.
Yeah.
Pain and fear are the greatest, one, limitations for performance, but then two, the greatest means to stopping an exercise program or to progressing at all.
Sure.
People give up because of pain, right? So what we have to do is pain's not really the problem, it's that information. What's underlying that pain? Fear.
Right.
What's maybe underlying the fear? Oh, maybe it's an identity problem.
Okay.
Maybe they're afraid that they're not going to be able to do that sport anymore, which has made them, they've been the soccer player their entire life, right? What happens if they can't play their sport? Now what? Right?
I went through that. Yeah.
I went through that too. And I could tell you a quick story about that.
Yeah, go for it.
So you mentioned that I work with the Olympic teams.
Yeah.
And the shooting team is one of the teams that I just love working with. And we were actually on a trip down in Guadalajara, Mexico.
Okay.
Great time down there. If you had a chance to go to Guadalajara, it is a blast. Okay.
Megan put that on a bucket list.
I could show you around. I love Mexico. I think it's a great country. Well, prior to this trip in 2018, I mentioned I was a baseball player, right? I was also a catcher.
Okay.
So people always ask me, well, do you
How are your
have bum
knees?
knees? Yeah. It's like, oh God. I keep going back to Major League.
Yeah.
Where it's like constantly icing them.
Yeah.
Like, that's not always the case.
Right.
So my knees were actually completely fine.
Yeah.
Never had a problem with them, actually, until I met Kendall. That may not be a story I can tell on this podcast. But anyway, I had hurt my knee in a specific situation.
Sure. Yeah.
People can read between the lines on that one. I actually popped the meniscus.
Ooh,
right.
I've done
So
that.
I heard it. And then there's actually this little trick that you can do. If you kick your leg really hard and fast,
Okay.
to straighten it, right?
Yeah.
It'll create some negative pressure and pull the piece of meniscus back inside the joint line.
Okay.
Old PT trick. So I did that, and it worked. It went pop, pop again. I was like, oh, I'm good.
Did you finish?
Of course.
Okay, perfect. Just making
Because
sure.
I'm a winner.
Not a quitter.
So,
I'd ask that.
yeah. So that was in October.
Okay.
Fast forward now to this trip in Mexico, which is in now November of 2018. And it's great. Like, I'm running on it. I'm squatting. No issues, right?
Sure.
Very successful trip.
Yeah.
We ended up winning a bunch of medals, a couple Olympic quota spots for Tokyo, which ended up being in 21.
Sure.
And they sent a 10-person passenger van for 14 of us. So, yeah, you can do the math on that one. Didn't really work out so well. For 14 of us, plus luggage, my physical therapy equipment, our guns, all this stuff.
A lot of stuff,
A lot of stuff. So I'm one of the bigger guys there.
Sure.
Right? And so I'm playing that sick game of Tetris, trying to piece everything together.
Yeah.
I'm the last person to get on the van, right? I go over to step over one of my athletes because, he wasn't moving.
Yeah.
Another story. But stepped over one of my athletes, put my left foot in between like the seat cushions as I was squatting down into the seat, and heard the same. And there it goes again. I'm like, well, I've been here before.
Yeah.
Right? That's not a big deal. So I kick my leg really hard and fast, except this time I start feeling anterior joint line pain, like searing, like a hot poker right in there. I'm like, that didn't work.
Yeah.
And I just noticed the swelling kind of pushing out into my skinny jeans. Actually, these ones that I'm wearing right now, aren't they nice?
So nice.
Yeah. So I kind of reclined myself in the chair of the van and put my leg up, which, mind you, now is right behind the driver's head.
Yeah.
And watched as that swelling just kind of pushed out into my jeans. And then also, all of a sudden, all the thoughts started flooding my mind of like, oh, shit. What am I going to do now? Right?
Yeah.
I can't train the way I want to. Is my girlfriend going to love me? I'm going to get fat. Like all these questions,
scenarios,
right? And then the worst one being like, oh, shit. How can I be the PT movement guy that hurts himself getting into a fucking passenger van of all things, right?
Sure.
And it was a very humbling experience being carried through the airport by the coaches. I tell you what, I tried to take a step out of that van and fell flat on my face. It was gone, right? Bruising, swelling, the whole 9 yards. But that was that identity piece.
Sure.
And I think that's what happens with a lot of athletes, or anybody for that matter. You're hurt. You can't be who you want to be.
Sure.
And all of a sudden, those thoughts, those questions about the future start flooding your mind, right? And then we become very cautious, become very hesitant, and then everybody becomes Dr. Google and goes on searching, and all of a sudden you got cancer everywhere. And it's like worst case scenario situation. And that's quite honestly a lot of the walls we have to break down when I'm working with somebody is we have to go back and start peeling those layers back of the different belief systems and like, well, what does this mean to you? Yeah. So you go bring up your hamstring example. Well, maybe it's their fear around it. So they are very hesitant. They're overanalyzing, overthinking. But what if they thought less? It's usually a better outcome. Sure. Right. So how do we get them to do that? Well, we have to help them become more confident in their body again. And that is what all this kind of education piece is so valuable, right? Because the minute that you understand more about your body and you're more confident about what's going on inside of it, guess what happens? All those threat levels start to come down. Yeah. So then the pain response is also going to lessen with that. We've got great research on it. So that's like a 1-to-1 correlation with that right there. So then once we can dampen down the pain with education, now we can start to introduce novelty of movement, work on finding the source of the movement problem, which could be, maybe you're looking up on the horizon when you're sprinting, so it's going to tilt your pelvis forward, and now you pre-lengthen the hamstrings when you take a step. That was my problem. That's why I corral that one off right there. So I'm looking up. Why am I looking up? Why? Just look straight ahead. Yeah. Makes no sense. But we do it, right? Yeah. It's just an ingrained pattern that you develop. So that's where the fun part comes in of like the puzzle. Yeah. Like breaking down the body and beginning to rebuild it by introducing new movements that are going to be a eustress, so a positive stress to that individual.
And one of we brought in the fear piece, the hamstring piece, and I immediately thought, because I'm thinking of When you thought about athleticism, if my buddy Jordan Pacific is the watching, listen to this, he was like the epitome of that dude. Like he was maybe I'm going to slaughter, maybe 5'9", 5'10", could dunk a basketball. He could do anything he wanted. Any sport he wanted to pick it up, boom. My other buddy, same way, pick it up and do it. But when I'm thinking hamstrings and injuries, we had a receiver in high school actually, who was his speed was insane. Like his head it was just so weird when he would run. You'd just be like, oh my God, how is he doing that? But then boom, he pulled his hamstring and then he always babied it. And I'm thinking subconsciously, right? If you go into a run or a race, what are you going to warm up the most? What are you going to focus on the most? You're just going to focus on one side a lot of the times. And then when you're running, if you're going to kick the leg out and you know you have a bad hamstring, you kick the leg, it stretches and it obviously lengthens, but it tightens that hamstring. You can have a tendency to not fully extend, or you baby it a little bit more and you fully kick out the other side. And then you start to sacrifice other areas of your body, and then you start kicking in new forms of muscle memory where your body's like, well, I guess this is just how we're running now. And then one bad hamstring turns into, what the hell is going on to the left side of my body, or why does my back hurt like crazy?
It's like a domino effect, right?
Yeah. It's the kinetic chain. And if the kinetic chain, which is, for those of you who don't know, it's like each piece, like our leg, like our hip, our knee, our ankle, it all works together. If one spot is just bogged down, then the rest of the kinetic chain will not work properly. But if you're not aware of it, if you're not cognizant of it, you have to fix it or you're going to injure yourself.
Right. And that's where it's like everybody should have somebody to watch their movement on a yearly basis.
Yeah.
I have my own coach. I don't program my own shit
Sure.
because I can't see my blind spots, right? It's kind of like the dentist model, right?
Yeah.
Everybody goes get their teeth cleaned twice a year maybe.
Sure.
I like mine 4 times a year because I'm a little bit...
That's fine. You're allowed to be.
I like my clean teeth.
Pearly whites?
Yeah, I do like those pearly whites. I'm very, very stringent about that.
It's fine.
But yeah, it's kind of one of those weird quirks that I got. But anyway, so you brought up this idea of the kinetic chain and how you start to see this weird kind of domino effect kind of go upstream or opposite side of the body. And essentially what you're explaining are compensation patterns.
Sure.
Right? The compensation that start to develop in the body from a specific injury.
Correct.
And I use this analogy all the time that an injury is kind of like trauma, right? So in the case of the body, it's a physical trauma, but we know you can experience trauma from all different sources, spiritual, emotional,
too many different ways,
sexual, like it's all encompassing. But at the end of the day, it's all just stress to the body. It all gets dumped kind of inside.
Perceived the same way,
Yeah, perceived the same way inside that bucket. And that causes dysfunctional patterns to emerge. And if you think about, a sprained ankle, which is really kind of a common thing for everybody to understand, is, well, let's just say you sprain your left ankle. What are you going to do initially? You're going to take weight, put it on the right side, to let the left side heal. Technically, that's a dysfunctional movement pattern.
Yeah.
But it's supposed to happen. The only difference, though, is that it's supposed to be temporary.
Short term, yeah.
But what typically happens? Well, we focus, like you mentioned, on that one ankle, on that left side. And we only worry about that. We try to manage the swelling. We try to get it moving again. And we never really teach the body how to trust the left side again. Sure, we manage the pain, the swelling's down, there's no more bruising anymore. Maybe the tissues have healed. But from a movement perspective, they're still kind of technically injured because you never taught the body to be confident in that side.
Right.
So then what happens is those dysfunctions turn into the permanent movement patterns that we call these compensation patterns, which then just leads to that accelerated tissue kind of stress in the very specific areas, very specific muscles, ligaments, tendons, parts of the joint as well, which has been one of my kind of specialties, is trying to distribute load throughout the joint more appropriately with people, because I think that they fall down this linear movement paradigm and they never really stress the full capability of the joint, which then leads to all these joint replacements, stuff like that. But it kind of then is going to downfall in one of 2 different scenarios, right? First one, you're going to hurt yourself. Again, you're going to experience some type of pathological tissue damage we know as injury.
Yeah.
And this happens more so in us men because we have egos and we will literally put our head through a wall despite our body.
Sure.
I see it with my SEAL team guys that I work with.
Oh, yeah.
Prime example of that. It's like, oh, you have a stress fracture in your foot for the last 8 weeks. You didn't tell anybody about it? Maybe. No, it's not that big of a deal. True story.
Yeah.
Or second scenario is we develop these new compensation patterns to offset the old ones. Typically happens more so in women because, let's be honest, women are smarter than us. They're usually more attuned with their body and they try to figure things out. But the kind of moral of the story is you keep going around and around and around this vicious cycle because you never address the original trauma and the dysfunction that originated the injury in the get-go.
Yep.
Wild, right? And this is kind of my big pet peeve with the standard of care physical therapy, because we're so good at managing the pain. That's all the physical therapists kind of really want to worry about. And quite honestly, like taking away pain is a big deal for a lot of people. I just think we take it away too quickly.
Yeah, I know. I remember you posting about that, and I agreed with that.
Yeah, absolutely, because it's that information. It is a source of knowledge for us, and we get rid of it. We don't know how to handle it. We don't know how to work with it and learn from it. And that's a big problem.
Yeah.
Right? If we take it away too quickly by masking it with different things like manipulations and dry needling and cupping and massage, like you name it, there's a whole host of modalities we could use. And believe me, I was a mobtard at one time. It's a trademark term.
Fair enough.
I have for myself.
Yeah.
Me and my buddy Nick Kyle, PT out of West Virginia. I don't know if he's going to listen to this. Maybe he will. He kind of coined that term, and we've just been using it now for like the past 13 years that we've known each other, is that we try to mobilize the shit out of everything.
Yeah.
A la the whole Kelly Starrett mobility wad, supple leopard kind of paradigm. And then you realize that, it's not really fixing the source of the movement problem. We're just putting a Band-Aid on it. You see those memes all the time, like duct tape holding up a curb. Like, that's what I envision every single time.
Yeah.
It's like, and I wasted 45 minutes to an hour before and after training trying to work on these mobility problems, but I just needed to really correct my movement patterns to begin with. So that pain is super valuable information, and we can start to learn from it. But we see that this is kind of developed, I think, from an early age. And you got a kid. I don't have a kid. I've got 2 puppies. Feels like I have children sometimes. The one is really an asshole. It's really funny because I've got 2 dogs. The one is like the angel, the golden child.
Yep.
The older one, the younger one, complete asshole.
Yeah.
The better hunter, because I train hunting dogs.
That's right,
better hunter, but she is a dick. Yeah. And she's the problem child that we have to discipline all the time. So I feel like I am kind of preparing myself for parenthood eventually.
Fair. Yeah.
Probably not the same thing though. But you had mentioned a story about your kid getting hurt and boy who cries wolf type scenario where he was actually bleeding and hurt himself. Right?
Feel bad.
Yeah. Well, you're seeing this a lot, I think, with a lot of kids these days who don't really understand the difference between hurt and being injured. And I think a lot of it is a source of parents who we try to protect and kind of envelop these kids in this bubble for their own safety, it's really weird to me because I grew up in, like I said, backwoods of Pennsylvania. Like I was climbing trees, I was hunting. I was shooting shit out my bedroom window with a bow, pinning birds and rabbits and shit to the embankment. Well, I was kind of an asshole kid too myself. But it taught me a lot of skills. Like I would fall down and get hurt. I'd be out from 9 o'clock in the morning, 6 o'clock at night. I'm sure you kind of grew up in a very similar way.
100%.
And you would fall down and get hurt. You would come home with skinned knees and elbows and stuff. And you learn to manage that, right?
There's so many stories about that, but yeah, you're right.
Same thing, right? And then I got hit in the face a couple times as a kid, got into fights because I was kind of a cocky asshole to some extent. But you see a lot of kids don't really understand what it's like to experience that. Yeah. Right? They don't know what it's like to be punched in the face. And Mike Tyson has that line there, everybody's got a plan until you get punched in the face. Right? And I don't think a lot of kids experience that, so they don't know how to handle violence. Yeah. It's a really weird concept for me because then you grow up and you get into a situation where conflict ensues and all of a sudden they don't know how to manage it. So maybe we overreact. And that's where you start to see these, really pervasive conflicts of anger and violence start to ensue in young kids. Yeah. And you can go down the rabbit hole of social media influence behind that and everything too. Yeah. But I do think it comes back to those cultural belief systems of growing up. And we put these kids in a bubble. They don't do anything but sit inside the house and play video games and on the cell phones all day long. Yeah. And they don't know what it's like to handle violence. They don't know what it's like to load the body and make the tissues uncomfortable. Yeah. I'll tell a quick story. When I was in Austin, Texas a few weeks ago, I had the opportunity to do some Brazilian Jiu Jitsu for the first time ever. I was a wrestler in high school, so I thought I had maybe some type of a background with it, but I learned very quickly that was not helping me at all.
No, it's just arrogance on the
It was just arrogance, right? Yeah. The arrogance came out in full force. Just getting tight. So I had this Tim Kennedy sheepdog response course, and we did 4 hours on Saturday, 4 hours on Sunday. Jeez. I felt like a truck hit me after all that too. Sure. But it was one of those situations where I was getting mat burn all over my body. I was hurting, sore in new ways, but I kept going, right? Because I could tolerate it. I understood what it meant. I wasn't injured. Yeah. I felt like dog shit.
Yeah.
But my tissues were just stressed out in new ways, right? And so I was amongst a group of like 30 some dudes. Okay. And mind you, many of them not having any experience with it either. And they were big guys. And like, I'm 6'1", 205, but there were some bigger dudes there.
Yeah.
The only difference is I have some body awareness. Some of these guys just came at you like meleeing fists. So I took a fist across the face, broke open the skin on the inside of my nose, had a black eye for about 2 weeks.
I saw the black eye.
That's what that was from, right? So of course the arrogance came out, ego came out, and the same guy that did that, it's like the big old fuck you, right?
Yeah.
I'm gonna take your ass down now.
Sure.
So there was this old wrestling move that I used to do that I got all my pins from, where I would bait them in to get the leg.
Yeah.
And then I would get an arm up around their head and underneath their shoulder and flip them. I would toss them.
Ooh.
That was my move.
Yeah.
Toss them every single time. The only problem is they gave us a clear and explicit instructions before we started sparring that there were no chokes and no throws. Right? And it was just instinctual.
Yeah.
I baited him for it. He came in. I tossed his ass. I jacked up his neck. Felt real bad. I fixed the neck later.
Yeah.
It's okay.
Sure.
We're friends now. It's good. But it was one of those lessons where it's like, oh shit. Like I let my emotions kind of get the better of me there. But then Tim Kennedy saw that. And he saw how like, I guess, stoked I was and like ego and puffed out chest and all that. He came over to me. By the way, my hair was in a ponytail and it was down. I was huffing and puffing at this point. He grabbed my hand ever so gently, like a little child, and brought me over to the corner. He's like, come with me. Took me over to the corner of the room and proceeded to whoop my ass for 5 minutes. Right? Which is there's a great lesson there, right?
Sure.
Because, you know, you get on your high horse.
Yeah.
Ego gets in there, you feel real confident, and then universe comes down, just fucking knocks you down a few notches, which I think is a real valuable lesson.
Huge.
A lot of kids go through life and young adolescents and even into college where they don't fail at all.
Yeah.
So you come back to now this injury piece where we get hurt, we experience that type of injury, we don't know how to be resilient in that situation. We don't know how to learn from that and move past it. We get stuck in it. It's almost like you kind of develop yourself in this well of a movement rut, both psychologically, emotionally, and physically.
Sure. Yeah. I think, did you ever see the movie Zoolander?
Of course.
Because he's not used to it. He's like, what is this salty discharge? And he's like, it's just tears or whatever coming from his eyes. I think it was Zoolander that they did that. But if you think about it, like kids growing up now, again, with having kids, like, what's their threshold? You know, like a stub toe, the first time you do it, it's like, oh, what the, that sucks. But then if you do it again, you're like, okay, I said ow, but it didn't really hurt that time. And then you do it again, you're like, oh, that was stupid. Or like, what the hell did I do? And so like the threshold starts to go down. You have less of a perception of what pain is with it, like associated with it. Like, that's not that bad. But then, trust me, like I remember I tore all of the ligaments in my left ankle playing football, played the whole rest of the season on it because my athletic trainer was like, oh, you're fine. You just have to wrap your leg in a freaking boot and good luck. Did that, tore my medial meniscus in college twice.
Same side?
Left side twice. Had surgery on it twice. Played the entire season with a torn meniscus. And my coach was like, why are you so fucking slow? I'm like, I'm running as fast as I can. But I remember when you're talking, I'm assuming like the locked knee example, that something similar happened to me at that time. Locked in there.
Are more alike.
And
I'm finding this out.
I wish I knew about the kicking thing. I was punching my knee until it would release. Yeah, it's very meathead of me. I'm like, break it or
you're like Fonzie, like just let's
come on.
The song comes on.
But yeah, I mean, like my threshold for pain is quite high, and there was actually it was a neurology class I took at Penn State. It was like kinesiology, neurology, and it was like the first time I got to know like the brain, pain, purpose, all that stuff. And I'm like, we talked about certain examples, and I was asking my professor, I'm like, I don't think I have normal pain thresholds, like because I've been punched directly in the face, and I'm just like when I'm in the zone, like you can do whatever you want. And I used to say like, if you're gonna hit me, you better make sure that I go down.
Make it
if
count.
not, I'm sorry for what's about to happen. I had that happen in college. A guy punched me right in the face, and I headbutt him at a reflex, and boom, he dropped, and he didn't come outside for 3 weeks afterwards because he was embarrassed. Said that I jumped him with a whole bunch of other people, but he actually broke hangers over one of my buddies' back in the shower. Long story, but yeah,
These are wooden hangers.
No, they were plastic.
Oh, plastic.
They welted up his back, and the dude came out and he had welts all over his back, and he was like bawling his eyes out because they turned the lights out and just boom, 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 beat the shit out of him.
You've had a very different college experience than I did.
Yeah. So anyway, so I think it's really important for kids to learn that threshold, and trust me, it's difficult. Like with our son, like he was not the best walker / runner. Like he would just run into fucking walls. Like boom, like bro, pay attention. Like what are you doing?
Conscious awareness.
Yeah, but he's just so distracted by everything else. He wants to play with everything. So he's like all over the place. But like the more you kind of take away the reins, you're like, listen, that's stupid, but I'm tired of telling you that you shouldn't do that. Like go learn. Figure out what happens when you do that. And then come to me and explain what you learned from that example. And we'll fix it.
I think that's beautiful because I think there's a great parallel here between being a dad or a parent and being a coach.
Sure.
Essentially, your main job, your role is just put up some guardrails, some boundaries and some expectations, and let the kid or the athlete, in this case, from a coaching standpoint, explore.
Yeah.
Let them explore, let them figure some shit out because you're providing the constraints, and those constraints provide structure. Yeah. Right. It's a loose structure, but it's a structure nonetheless. And that is where all the physical and emotional and psychological kind of transformation can occur because it's inside that structure, that container. That's why we call these things coaching containers
sure.
Right? It's the same type of thing. It's it's really interesting because I don't have kids, but like I said, I have dogs and I'm in a relationship, and it is kind of our job as the masculine, the male figure to provide that same type of structure and the same type of container for the relationship to be successful. So you see a lot of times too, there's a lot of these parallels, and if we're kind of deficient, especially from a masculinity standpoint, at being able to hold awareness, be present, and provide structure, the relationship will disintegrate. We talk about the kid's trajectory in life may be now skewed because it doesn't have those guardrails in place. And then we look at the athlete in the coaching scenario, you're not going to get the outcomes that you want. Right? Because we didn't provide them with the right amount of constraints or the right amount of boundaries to be able to work within and kind of guide them down that path, guide them along that way.
Yeah.
I think that was just beautiful. I had a light bulb moment there. I'm like, oh shit, this is cool.
It's perfect. And really going into this whole episode, like we didn't know exactly what we wanted to talk about, but there's a lot of gems
right there
in just that. But I mean, I am so obsessed with athleticism and pushing the human performance. And like the reason, like, you're a doc and you're a PT, but you're not. Like I don't want you to squeeze into the container of a PT, you know what I mean? Because like I have such a bad taste in my mouth. I can't, like, as a chiropractor, like I hesitate to send my patients to any PTs because they're fucking stupid and they're having them do motions, and I'm just like, just use your logic thought for a second, like just for 1 second. Or they'll put like an 85-year-old man through the same routine that they're going to put a 15-year-old athlete through. It doesn't make sense.
It doesn't make sense. It's hilarious. It's one of my biggest kind of pet peeves about the whole physical therapy profession, and I'm right there with you. I really struggle finding a definition or a label for myself because I don't feel like I fit into the physical therapy profession at all, because majority of them do kind of follow these, algorithms and protocols and stuff from surgeons, and they don't think. That's the problem. I didn't pay $300,000 to go to Duke to follow
plug and chug
somebody else, right? And that is just kind of my personality. I'm kind of rogue. I go against the grain. I don't take orders very well, which is why I have my own company, because I have to run the show. Also, another story for another time. But anyway, like this, similarly, I can't call myself a PT because I don't agree with the label of the majority of physical therapists, because we've got really like a marketing problem, because nobody really understands what a PT does, or they think about what you just described. You're in command, you get your hot pack, you get your ice at the end, you're going to get your little rub down, and then you're going to go to like a high school student to do your exercises, which is just so ass backwards in my mind, because like the movement stuff is the gold. Like that's where you make the changes and the adaptations. And you're right, people do get the same kind of cookie cutter approach when it comes to their injury or whatever. They get put in a lump, back pain box. Shoulder box. Oh, they got a hip problem. They do the same bullshit. And I kind of joke that I'm actively unlearning everything I was ever taught in PT school.
I feel you.
Because it's kind of true. There's always a shred of truth to that.
Sure.
But where I think that the profession needs to go is we need to teach more of this critical thinking.
Yeah.
Logic, right? We don't do that anymore. And that's part of the education system
Yes.
as a whole,
Yeah.
where we teach kids what to think, not how to think.
Right.
And that's a really big problem. And it's also why I'm just getting around to hiring my first PT, because I haven't found anybody I trusted yet.
Yeah.
And it took me 6 years to do that.
Yeah.
Right. But now I finally got a guy who I love, who is a really, really good critical thinker and isn't afraid to ask questions.
That's how you learn.
That's how we learn. Most of my consultations with clients, which I'm sure yours are the exact same way, we ask a lot of questions because we got to learn about the individual, learn what makes them tick, how they think, what their past experiences are like. And then we can get into a little bit of the movement stuff and try and figure out those pieces of the puzzle. But it's about connecting with that individual first and learning to think outside the box and on a deeper level that makes this successful, right? You get stuck inside that paradigm of being put inside of a box. The patient doesn't feel good about that, right? And you can tell. I've been in a number of clinics where I know the clinician isn't happy. Like you're getting burnt out seeing 3 to 4 people an hour.
Yeah.
No wonder people get out of physical therapy so quickly, right? It's a burnout.
Yeah.
It is that plug and chug type of methodology, but it's kind of sourced from the insurance model of things as well. And you're kind of bowing down to whatever the insurance company's going to reimburse you for instead of actually being a clinician and using your brain and thinking for it. It's mind-boggling to me. I checked back in, somebody actually asked me the question about this, and they still pay more for the hot pack than they do for like the corrective exercise. I'm like, what?
Well, they do that for chiropractors too.
I'm sure.
Yeah.
I'm sure it falls along the same paradigm, right? And and that's a whole like structural kind of paradigm problem than it is really about the individual. And, I for the longest time, I felt like I was on an island.
Yeah.
Right. Until I met people like you. And I'm like, oh, we're kind of on the same island. We may not be the majority, but we're definitely doing something different.
We got the best island.
And we got the best fucking island, right? And more people.
We're all healthy, we're all happy,
let's go to our island.
Fit. We're good.
Water's great.
Yes.
Right?
Yeah.
Which is, I heard a line, I'm going to probably butcher this, right? But it says, as the island grows bigger, the island is knowledge, and the shores of ignorance grow with it.
Okay.
Right. So if you think about that, I totally butchered it. But,
but
like,
I get it. Yeah.
As we gain more knowledge on this island, of us kind of
Sure.
collectively progressing our professions forward, those shores of ignorance grow larger too.
Sure.
Right. I think that's a huge problem, not just within our profession, but in kind of like society as a whole in today's day and age, culture and everything, is that, there's a difference between being ignorant and being what's called nescient.
Okay.
Right. So nescient is derived from like not knowing, and science, so not knowing science, not knowing information.
Yeah.
I could work with people like that. The ignorance piece, though, is I'm giving you information, or you tell me that you know about this stuff, but you're not open to learning and acknowledging other information.
Sure.
Right. That's a problem.
Yeah.
Because those type of individuals tend to react more emotionally. Right. And it's really difficult to have conversations.
It's out of insecurity a lot of the times, too.
It's out of insecurity as well. And believe me, I've been there before on certain topics where I feel myself like, why am I all hot and bothered about this? Right?
Yeah.
I'm getting all sweaty.
Yeah.
Speaking of, that's how we met. You were sweating like crazy.
Well, thanks for throwing that in there. I appreciate it. Yeah. When we first met, it was not good. It was great meeting him, but we met at a little place. We met at your house and went down, got some juice and sat outside, and it was like a month or two. Juice boxes, little Kool-Aid packs, snack packs.
They're Capri Suns.
Capri Suns, yeah, of course, just the healthiest stuff. But we're sitting down at this table, and we're just talking, and it was like my first summer in Arizona, and I'm just
drenched. You were soaked.
And he was like, "This is why we don't wear pastels or whatever." And I was wearing like a green shirt that was just, I think it was dark
but
green,
then your
hunter
shorts
green.
Also.
Shorts were disgusting.
And I stood up to walk away, and you were still sitting. I'm like, why are you still sitting down?
Yep. And I was like, bro, I can't give you a hug. I'm not going to do this to you.
I mean, the swamp ass was impressive.
It was probably a record ever. I think the only time my butt's ever been that wet is if I was in water.
Well, I'm glad to see now that you've acclimated. And
I've acclimated. I'm not sweating. My thermostat
state
in the house is at like 76, 78 degrees at times. I'm outside. I'm getting there.
Oh, that's fantastic.
Oh my gosh.
Yeah. So we can work with nescient people, not with ignorant people.
Right.
You
Yeah.
can't be emotionally reactive. You got to check the emotions. And that's where, I'm going to kind of bring this back full circle too. One of my favorite books of all time is A Man's Search for Meaning. Have you heard of this one?
I don't think I've heard that. I've heard of a book that had a similar title to that, but I don't think I know that one.
So A Man's Search for Meaning is written by Viktor Frankl, who was actually a psychologist during Nazi World War II Germany.
Does it have a candle flame on the front? I have that book.
Yeah, you should read it.
Okay.
It's a good one. It's not that long.
We got it for graduation from chiropractic school, actually.
Oh, you did?
Yeah.
Oh, that's great. Yeah, it's one of my favorite lines in there ever.
Okay.
And Victor states that between every stimulus and response is space.
Okay.
And in that space is where we can make a choice.
Okay.
Right. So when it comes to situations like that, or maybe you are presented with new information, or your body is stimulated in a way where maybe you are injured now,
Sure.
how can we create more space? Because if we create more space, we have more time to think and critically think and logic and reason versus reacting emotionally to a given situation.
Yeah. A little buffer.
A little bit of a buffer.
In between, what happened and your reaction, like the cause and effect. You have the in between. How do you perceive this? Take time. Don't rush. Don't get irrational. Because irrational thought, it is a lot of time emotional.
And that's what happens when people are hurt and injured too. We get these blinders on and we become so fixated on the end goal of removing pain or healing the injury that we don't learn to kind of trust the process in between. And that process may be long. And I see a lot of people who aren't in pain, they just want to improve their mobility or improve their performance in the sport. And hey, this isn't going to happen overnight. This is going to take some time. So I want to make sure that you are enjoying the process.
Is my insurance going to cover this?
This conversation? No. I will bill you later, though. I will send you an invoice.
It's like the most common question I used to get. Is this? But is it covered under insurance? The stuff that works does not get covered.
I think you're missing the point. Dude, I love it. Early on in my career, when I started my own practice, that was the biggest roadblock I came up against was this insurance question of you're cash based. And mind you, when I first started, my rates were real fucking low. Yeah. Right. And to the point where I'm literally $10 over your fucking copay that you would be at a regular clinic right now. And I just spent an hour with you, maybe 90 minutes with you, and you're asking me if it's covered by insurance? What? Oh, yeah. I've learned to screen those tire kickers out now. I'm not afraid to say that anymore. That's my interview patients.
That's how when I tell people to go to a chiropractor or a PT or somebody in the health profession, they're like, how do I know if they're good? I'm like, if they bill you cash, they don't accept insurance. And they're like, what? I'm like, well, think about it this way. Because I charge, I don't bill anything into insurance. You don't. We have to be really fucking good at what we do in order for us to still stay in business. If we're still in business 5-6 years or so down the line, right, we must be doing something right. And it's...
Or you're just so good looking that people just want to come spend time with you.
Yeah, it's a possibility.
Can I put this out there? I'm going to put this out there in the universe. We might be the two most jacked doctors on the radio right now.
I think... You know what? I thought about that coming into the car. I'm like, the funny thing would be how do you get two good-looking guys like this in the same room together?
It's a small room, by the way, folks, too. It's a tiny room. We're literally right next to each other.
We are bigger than this room.
Essentially bigger than this room. We're so close, I feel like I'm going to kiss you at some point here. Because this mic is right in the middle of us.
A little screen there. You know what I need? A plexiglass screen.
You sure do.
I think we're too close.
You sure do. We are not within or without. We're outside 6 feet.
We're definitely not.
Definitely not.
Yeah. The only reason we're not closer is probably because of this microphone. Yeah, you're right.
I don't know. I mean, the biceps.
Come on.
Do we? Oh, I think that this. Are we gonna do this right now? But I will state the sweating that I've got going on.
I'm better. I'm better without the sweating. I'm better than what you're working.
We should break out a tape measure.
I don't have a tape measure. We can do it again.
We could do it again.
Yeah,
we'll do it again
for sure.
Let me go get a couple curls in real quick. And then we'll Sorry to derail you.
Oh, you're good. I love this stuff. So on that, in that same vein with speaking of biceps, in that same vein, with what you're talking about, the whole time I'm like, boom, I know the term. You've got allopathic PTs, right? Where you come for a problem, as soon as you're diagnosed with this problem, that's the protocol that you get, right? And that's what people are used to. They're used to, hey, my back hurts, not to bring up a certain somebody again, I'm going to get 37 cortisone shots in my back.
Wow, definitely called him out though.
He knows that. He's like, he couldn't walk. And I get it. I totally understand. But really, most people, again, talking about, like, he's got a high pain threshold.
Yes,
Right? The dude's a beast. So in order for him to be like, listen, I needed to do that to get by, to move, to function, like, I got you. But don't forget why it happened to begin with. And that's what I do in my profession with, again, like, I'm a chiropractor, that's what my doctorate's in, but I don't call myself a chiropractor, and I'm not a naturopathic doctor, but I'm a naturopathic health expert, and I mix all of this stuff into this bucket because I know naturopaths that are terrible. They're fucking awful at what they do. They're allopathic, holistic doctors. You've got a problem, take this product. I want to find the cause. I want to find out why your body is dysfunctioning.
I'm laughing because it's literally every one I've ever come across.
That are bad.
Like, here's like $300 to $500 a month of supplements you now need to take.
Yeah. And it's like, okay. Like, there's patients in my clinic and stuff that are paying that for supplements, but the difference is you're on that for a short period of time.
Right. It's not
there
forever.
is an end date to that. Just like medications, right? Which will probably get fucking shut down again. But like, when you get put on a blood pressure medication, they never say, like, hey, Matt, you're going to be on this for about 3 months. We're going to work on your stress. You know, I know your relationship might be hard or whatever. You might not be sleeping. Like, they don't do any of that. They're just like, you know what? You've got high blood pressure. What are we going to do? We're going to smash it down. And then you're like, oh, but now
what?
Now I'm exhausted. I'm so tired all the time. What am I going to do? I can't focus. And they're like, oh, well, let's give you something else to give you a little bump. A little about like an Adderall or a Ritalin to bring you up again. Oh, but that's good. Like, the stuff that I hear, and I did an Instagram story on this where one of the people that I work with, she was saying that she had a client who was told that digestion only happens at night when you're sleeping.
What? Excuse me?
That's the only time that it happens. And I'm like,
what's happening the other parts of it?
what happens when you put something in your mouth and you start chewing? That's literally, mastication is like the first start of digestion. You're like, this is a GI specialist. And I'm like, what the fuck? What is wrong with people out there? And this is why America is so freaking sick. It's either they're over consuming medications, which in your line of work as well, like, and I don't know if you've seen this or not, and I'm curious now, those typically they're men who are on statins. Do you see a high correlation to injury?
Yes. The statins is one side of things. Obviously, then we have to talk about some other type of steroids as well, which are like, you know, cortisone is a big issue because that degrades ligaments and tendons and other soft tissue structures, especially around the low back. But the other one is our antibiotics.
Oh, God.
So Cipro, I learned this as a new grad PT out of school. And this is kind of, I'm not trying to pat myself on the back. This is just where like the critical thinking skills come in handy, because I had one guy, he was like 50 some years old. And mind you, you know that the tendon starts to degrade a little bit after 50, especially in the shoulder, in men particularly. And he had bilateral shoulder pain. That was the script that the doc sent him with, right? I'm like, bilateral shoulder pain? Like, he didn't strain both your rotator cuffs.
Yeah.
But he did. But here's the thing. Here's how.
Yeah.
It took some digging where I was actually going through like his medical history, and it had like 3 doses of Cipro within the past like 6 months.
Yeah.
Well, what does Cipro do? I'm going to Google that. Cipro degrades tendons. Oh, that's why you tore your rotator cuff tendon, both of them in the shoulders. Because I think he was doing some type of like yard work, something
which
basic.
Shouldn't do,
right? Which shouldn't do it. Right, but then that clearly damaged the tendons, right? But no doc ever thought about that. He's like, so I was like, did you know that? Did they tell you about that as being a side effect? No. So we're just gonna just pump you full of drugs. Mind you, he was on a bunch of other things, including statins at that time too. So probably had a role to play as well. Yeah. But I was like, well, we can manage the tissue problem, but you can't be on Cipro the rest of your life. Because it's going to start happening in other areas of your body as well.
Yeah, I mean, what I've found with statins to me are one of the dumbest drugs that have ever been created. The way that cholesterol was marketed is the dumbest thing. Like, it is Googleable. Like, you can easily find this. They fudged all the data, even when they're saying, hey, take this and it will prevent your heart attack and stroke. And then at the very bottom, it's like, it does not prevent heart attack or stroke. Like, what the hell? How are you even allowed to do that? But with statins, like it crushes your cholesterol, right? And you need cholesterol for tissue repair. You need cholesterol for testosterone, for your sex hormones,
brain health,
nerve tissue. So when you're taking something like a statin, you crush your testosterone, which no man wants low T. And then your nerves, your myelin sheaths, which are like the stuff that sends the signals really quickly. For those who don't know, they're like little pads, and it's like
insulation for your nerves.
Yeah, exactly. It sends a signal a lot faster. So when you're talking about fine motor movements, if we have demyelination where the myelin sheaths are starting to fall apart, the signals are frayed, the wires are open. It's like there's no insulation coating on it, and your signals are just going freaking haywire. So. I get, why the fuck are people on statins? Like, the negatives always outweigh the positives. And it's easy. Drugs.com. Type it in, and you can find all the side effects you want on this stuff. Go ahead.
Absolutely. And it's one of those things where it's like nobody wants to take the time to actually get to the source of the problem. Yeah. And I think that's part of the problem with our Western society, Western medicine type of thing, is that we don't look holistically at it. Right, you have to, and that's why my brand movement is an acronym.
Yeah,
movement, vitality, mindset, nutrition, and training, because
nutrition's important.
Slightly.
For I never knew.
What you brought up cholesterol, right? And this is the most mind-boggling thing to me is that people think that they don't eat cholesterol. That's the way to lower cholesterol. It's not how the body works, right? The body needs cholesterol, and when you don't eat enough of it, it's then going to overproduce it. And then it's going to over-manufacture inside the body, which then raises your cholesterol. So we give you the medication to knock it down, like you said, but we're still not fixing the source of the problem. You need to eat some eggs. Right?
Well, when was the last time your body ever made a mistake?
Exactly.
Right? If your body made cholesterol, there is a reason that your body required it.
This is my biggest argument. I don't mean to get into like a vegan meat eating.
Oh, geez. Let's do it.
Oh, we're going to go here?
Yeah.
All right. So this is my biggest argument with the whole like vegetarian and vegan movement. And I respect your right to do whatever you want to do. I do have an argument against every single one of your talking points, but totally you do you.
Yeah, for sure.
You. No problem. As long as it doesn't affect me, I don't give a shit.
Yeah.
And my line with that is like, hey, we didn't evolve to eat meat. We evolved because we ate meat.
Right.
Because we ate meat, because we ate cholesterol and organ meat and everything like that, we developed a larger brain, which helped us evolve into who we are right now. Right. So then I'll use my father as a prime example. My dad was on Lipitor for a number of years, and I was going through, I think I was in my undergrad at the time. So I was like getting into all the exercise science and doing all the research and everything like that. And I'm like, yo, Dad, like you should maybe lift a little more and then eat some eggs and some red meat and you might be good. And sure enough, he went on more of that like kind of meat, because we grew up in a household that was following the whole SAD diet type of thing, standard American diet, where, fat was bad, carbs were good, which is why I was a fat ass as a kid.
Sure.
Real chubby Michelin kid.
Okay.
Yeah, I'm serious. I have rolls everywhere.
All right.
Little doughboy.
Yeah.
But we grew up with that type of mentality, and he couldn't figure out, like, he was an athlete, he was a collegiate baseball player, and couldn't figure out why he had high cholesterol.
Yeah.
And so me, as like an 18, 19-year-old kid, I'm like, well, why don't you try this? Lifting heavy weights, eating more meat, and guess what happened?
Boom.
Off of Lipitor, feeling a million times better.
Yeah.
Right? And all because he ate what the body...
Wait, red meat's bad for you. It's inflammatory. What are you talking about?
And this is the other thing too. It's like, you know what? So people talk about eating a more plant-based diet, which I totally agree with.
Sure.
Like, we know the healthiest people are the ones that eat the widest variety of foods.
Sure.
Colors of the rainbow when it comes to the micronutrients and the minerals and vitamins and all that stuff. So I try to eat as many different plants and vegetables and fruits and everything as I can every day.
Yeah.
Try to get the whole spectrum of the rainbow, not Skittles. Vegetables.
Don't taste that rainbow.
Don't taste that rainbow. It's not really that great. I mean, the sugar is great. It's amazing. Right? It's a post-workout fuel. Oh God, that dogma too, right? But I think people should be eating more of a plant-based diet because you do get all those added health benefits.
Sure.
So you can't ignore the protein side of things, stuff that actually rebuilds and repairs your body, right? And then everything you mentioned about the myelin sheaths and making sure your nervous system is healthy, because guess what? When you have an unhealthy nervous system, you're chronically inflamed from all the nasty processed foods. And by the way, processed soy and like tofu and shit like that, it doesn't bode well for the digestive system. Like the vegan farts are a real thing.
Yeah, they're legit.
They're absolutely legit, right? And when it comes to a pain sensitivity standpoint, we know that chronic inflammation in the body will heighten your pain sensitivity so you feel it more.
Sure.
And it lowers that threshold that we talked about for you to experience stress.
Yeah.
Which means you're feeling discomfort more often.
Yeah.
But it's really weird to me that we fall down this dogmatic path, and a lot of it has to do with marketing.
Oh, it's 100%.
It's interesting
Or
because
Netflix documentaries.
Oh, Arnold just lost so much respect for that dude.
There's two reasons.
Like
why
he's like, oh yeah, I eat a plant-based diet like 80% of the time.
Yeah.
Like Arnold, that means that you're eating meat like 20% of the time. That means you're not vegan, bro.
Yeah.
And by the way, when you were the best in the world and you were winning all these Olympias,
What were you eating, bud?
Well, he was eating meat. He was also taking handfuls of Diana ball as well.
Yeah. Well,
There are two sides to that story, right? But I'm like, you were the best in the world because of the fact that you trained really hard.
Mm-hmm.
You took a lot of drugs, but then you also ate meat to support the regrowth and repair of your muscle tissue.
Yep.
Like, it's necessary.
Yeah.
We need that. So that's a big conversation. I get people who are coming to me with like chronic pain. We have to talk about the diet stuff.
Yeah.
Right. And quite honestly, like I do a lot of yoga myself, and I see a lot of people from the yoga community who do follow a very strict vegan vegetarian diet who got chronic low back pain. I'm like, well, you're super mobile, right? You shouldn't have any issues.
Sure.
You have all this movement variability, this mobility, so why is it? Sure, it could be a strength problem. A lot of yogis don't like to train with weights for whatever reason. I'm not trying to make you bulky. It doesn't work that way. But we have to talk about the food side of things because you're just simply not getting enough protein in. And like from a menstrual cycle standpoint, and this is kind of your area, so I'm going to step on any toes or anything like that. But we have, especially because when you bleed, you lose a lot of nutrients, lose a lot of iron and stuff like that. So we need that in that time period to repair and regrow. But then also you need calories as well. And what's the most dense calorie standpoint?
Fats
and protein side, right? So, and it's satiating.
You know how many vegans I know who, and again,
can't believe it's turned into
you do you. I'm not going to do it. I eat plenty of plants, plenty of vegetables, plenty of fruits, but you'll get, I didn't mean to like scoff, but like you'll get vegans who are like, I'm vegan. Then all of a sudden they get pregnant. What's one of the first things that they crave?
Meat.
Mm-hmm. And they're like, I can't not eat it. I'm like, you need fucking iron. You need these nutrients. Your body is smarter than your conscious ego is. Let it do its thing. Listen to it. Feed it. And your body will take good care of you.
So this brings up a really interesting point because it's going to kind of full circle to how we started this conversation about the whole conscious awareness piece. Yeah. Like listening to your body. And I just got done saying how women are a little bit more attuned with their body. So and pregnancy is a great example for this as well, where it is a very heightened state of sensitivity where you are very in tune with what your body needs because you're fucking growing a human inside of you. Right? Yeah. And it's really interesting to me that we hear these signals, the body's telling us what to do, and yet we ignore it. So why is that?
Ego. I feel bad. I don't want to break my vegan thing. I'm worried about letting friends down, family down. I told everybody I was this, and now I'm going to do this. I'm a liar. I'm like
identity.
It's identity.
It's identity.
100%, which is what you talked about. Yeah.
And fear of losing that identity.
Which is insane. You're willing to, and I've quoted this 1,000 times. You're willing to sacrifice your health for somebody else's convenience or somebody else's feelings. Like this whole PC society where we're afraid to hurt other people's feelings by no, I'm sorry. I'm so sorry. I didn't mean to do it. I'm sorry. Like that mindset, it fucking drives me nuts. And again, having 2 kids, like I've got a boy and I've got a girl. Like I don't know how kids are going to be growing up. I know Megan and I talk about this all the time. Our kids are going to be freaks. And why? Because they're going to be natural. Yeah. Oh yeah. They're going to be natural. They're going to know things. Like Hoyt sometimes, our son, I think he abuses the fact that I adjust. And like when he smashed his face yesterday, I adjusted him. And his atlas and his occiput were just like,
all jammed up, right? Yeah.
And he was just like, thanks, Dad. I'm like, do you just fall and hit yourself so I'll give you an adjustment? Like, bro, I'll give you an adjustment. You don't have to hurt yourself to do it. But yeah, I don't know how we got off on all that, but
mind-boggling to me.
The identity of that, and again, if that's what you choose, if that's what you want to do, go for it. But I mean, I've seen, and then you'll get like the plant-based people who are vegans as well that are just like, you know what, sugar is vegan, and this vegan cookie is vegan, and then this vegan cupcake is, and then all of a sudden they blow up, and then they have blood sugar dysregulation. They're pounding down 100% carbs, not getting in the protein, not getting in any fats, and you're like, what did you do to yourself?
And I think it comes down to a little bit with the type of personality that they have as well. And I've got no data on this, so take it with a grain of salt.
It's fine.
But I
fact check us.
Please do. This is pure opinion and anecdotal evidence of what I've seen with people who are in any type of extreme diet camp, whether it be vegan, vegetarianism, keto, carnivore, whatever. There's this identity piece to it, but it's also a very addictive personality state, right? You become addicted to the way of living that encapsulates being a vegan. And addicted to the foods as well. So you start trying to break away from it despite what your body's telling you, and all of a sudden it's a crack of that identity piece, right? But then I've got a couple of friends that are like this, where they went from, it was really weird. They went from like very strict, like raw vegans to carnivore, right? So we went from
just complete polar ends of the spectrum.
Polar ends of the spectrum, and all because they had a lot of health issues on one end of the spectrum they couldn't ignore. So they go to the other end of the spectrum and started getting different health issues. And I'm like, guys, there's a wide breadth of shit that you could do in between.
Why can't we meet in the middle?
Why can't we meet in the middle? But that was it's an addictive personality. So they went from one end to the other end, didn't think twice about it because they thought that was good for their body. Well, if a little bit's good, more must be better. And it's not the case. It's like the human body is a very, I hate when we get PTs that start to refer to the human body as like a complicated machine, like a car. I hate that fucking analogy. It drives me nuts. We are nothing like cars. Vehicles, machinery, it's complicated, yes, but we are very complex. There's a difference. We're an inner working system of systems, right, that have a tremendous amount of different variables kind of working together and unfolding all at the same time. And we are a self-organizing organism, right? And what that means is when we take in a stimulus, and we talked about the stimulus and response effect. When we take in a stimulus, our body's going to respond and react in a way, right? And a very simple way to think about this, like if I'm standing up and I lean to the left, we stimulate the tissues on the left side of the body. They go into a little bit of a stretch, which then tells the body, hey, we're going to pull back over to the right. And you go through center, and you go over to the right. Maybe you went a little too far and stimulate those sensors, and now we come back to center. Same thing with the diet stuff. Like they're missing out on the sensory signals that are happening that say, hey, you need to kind of you come back to the middle a little bit, right? So it's like a pendulum swinging. And this pendulum swinging analogy can kind of be very diverse in nature with what's going on in society right now. We're kind of going to extremes. Eventually we'll find a middle point. But the same thing with the human body, hopefully. Hopefully, folks. We're just going to keep praying. Where the human body is the same way. You go to these different extremes. Eventually, the body will find a semblance point of center. But that awareness piece is key. You have to understand where you're at so you can start to work towards finding that new level of the centers as well. Again, a new balance point, that level of homeostasis is the word that we like to use.
And I mean, that's brilliant because, I mean, homeostasis, for those who don't know, it's that happy set point for us. It's where we're our happiest. When we have a little bit above, we have a little bit below, but our body always slides. But what happens is as Americans, most Americans spend too much time in one side or the other. And then you can actually have diseases that are associated with, overwhelming or underwhelming, especially when it comes to the nervous system. It's such a, like the amount of frustration is just rolling through me with, obviously not you, just society today and the dieting and the ignoring of themselves and just willing to sacrifice yourself is insane. And then listening to your body, like there's two things that I probably treat more than most other docs do, and it's low stomach acid concentration, or hypo or achlorhydria, and then there's an infection that could take place in there called Helicobacter pylori or H. pylori.
There's a lot of big words, Doc.
Sorry, not sorry. I talk about it all the time, but so this little pain in the ass of a bacteria will live in a suppressed stomach acid environment. And so as a society, we're like, oh, we have acid reflux. We have too much acid. I need to suppress the acid. Well, in reality, it may have started that way, but then we drop our stomach acid too low from chronic stress, from gluten intake. It suppresses stomach acid from the parietal cells, more big words. And then, this infection just makes itself nice and happy and healthy. And so what happens is your body has these feedback loops, negative or positive feedback loops. And so people will be like, listen, like I have no appetite and I can't eat 10 meals a day. Like it's just impossible. I can't even eat 2 meals a day. And so you'll get these people who are super happy, like I can fast all the time. To me, I'm like, cool, but why aren't you hungry? You can't starve yourself for a long period of time because your body does require nutrients. You're going to burn through your magnesium. You're going to burn through all these things. Like something's going on in your body that's telling your brain to tell you to not eat food. Why? Is it an emotional thing? Is it anorexia? I have a lot of men who be like, no, I just eat 1 meal a day. And then I'll look at their stool test and I'm like, well, bro, your stomach is disgusting and you have no stomach acid. So what your stomach's telling your brain is, please do not eat any food, because if you do, I can't break it down.
Can't digest it. Yeah.
And then you get your anemia. You can get anemia from that because you're not getting your iron. Again, vitamin C goes down. Like everything falls apart from that point on. I guess digestion only starts at nighttime, but
so you're cool.
Yeah.
That's why you should eat 1 meal at night.
So you fix that, right? And then what I'll have people do is we'll eliminate the infection and or we'll increase stomach acid. And then they're like, I have never been hungrier in my life. I can't fast anymore. I'm just so fucking hungry. I'm like, perfect. Because now your body's able to repair the tissues that have been damaged for many, many, many years. And now you're actually getting nutrients from the food you're consuming.
And it's okay to surrender to those fucking signals.
Yeah. And people are like, I'm losing weight. I'm eating 3,000 calories a day. I'm like, cool. Keep it up.
And I think that's one of the big problems is we go down this rabbit hole of trying to control everything, right? So I said that I hate that analogy of the car and the body, right? Because the human body is very complex. It's a system of systems.
Sure.
And when we try to control a chaotic system like that, we're going to lose.
Every time.
Right?
Every time.
Every single time. And I mentioned earlier that I train hunting dogs, and the guy that I work with to train these dogs, he gave me a great analogy. Like, that's fucking brilliant. He said training dogs is like squeezing a water balloon, right? So squeezing is like the different training tactics and strategy and everything. And eventually, like everything's gonna pop like a hole's gonna pop up through your fingers, and then you got to push that one back down. And it's gonna pop up through another finger, and you got to push that one back down, right? And that's trying to control the situation. You just got to do something different at that point, right? But that's what we end up doing if we try to control the situation of chaos, and it's impossible. Yeah, it's impossible. Instead of learning to be consciously aware and listen to your body, and then give it what it needs. And I see this from a movement standpoint. We talked about the standard of care physical therapy, and I think it's the same way in the medical system where we try to control with drugs all the time. Same thing from an orthopedic and a movement standpoint. We try to brace everything, restrict it, restrain it, constrain it, when we can't do that, right? The body's going to break free someplace else. That stress is going to go somewhere instead of learning to work with the chaos of your body, right? And that's the cool learning experience. And that's the process that we talked about. Instead of being focused on the end goal, learn to love the process of learning your body, right? And your own unique body, because everybody's different. Yeah. And we know you're a snowflake.
I like snowflakes.
You do? We don't get any here, sorry.
I saw some in Pittsburgh. We went back last weekend. So. Saw some snow. I actually saw snow that I couldn't see 10 feet in front of the car, which was a shocker after driving, and it's like sunny and beautiful every day, which darn Arizona skies.
And it's
so
darn beautiful cold right now. We've got some family.
It's a little chilly.
Visiting from Cleveland. And I'm sorry it's cold and rainy right now.
Yeah, it's like I'm freezing at like 60 degrees. I'm like, jeez, it's embarrassing. Like my Pittsburgh blood went away.
Mine thinned real quick.
Yeah. I'm fine with that. I'm fine, because then when heat comes, I'll be like, I'll be okay. My sweat response will be all right.
Talk about an autoregulatory response, right?
Yeah, right? Well, what I should do is put antiperspirant on, right, to stop the sweating process. Shouldn't I do that?
Exactly. And then another example of trying to control.
And it pushes sweat. Like, oh my gosh, yeah. I've had people do that, and then they'll sweat profusely in other areas. They're like, what's going on? I'm like, you stopped the sweat response. Like, you're supposed to sweat and detox and get that out. Or if you're hot, then the air is supposed to cool you up. Stopping that. Like, what the hell is wrong? Like,
and my balls are super sweaty now. And I don't know why.
You know that they have deodorant for like.
You're kidding me.
No, they have deodorant for the vagine and the cojones. Yeah. That isn't actually. I didn't know that.
Those are medical terms.
Those are very medical terms. You can Google that too. But seriously, there's a commercial where a girl's going like this here, and then like, hey, you can do this, and you can do that. I'm like, you're just gonna wipe bit everywhere. Like, why does that smell horrible? Like, figure that out for all the future men's sake. Figure that situation out. God. So, I mean, it's just, I mean, talking to you, it's always awesome talking to you because it's really easy to get on our own island. Mm-hmm. And we're working with patients and clients all the time, and we hear the idiotic things that other people in either our profession or other professions are saying, and then it makes us out to be like the crazy ones. And it's tough. Like, you have to have those walls up. Like, I know what I'm doing is right. Like, I don't understand why so-and-so would say this or tell you that. It doesn't, like, from a logic, like, I think people need to use their logical thought again. They need to tap into that. If it doesn't feel right in their heart, in their gut, and you're like, that doesn't make sense, maybe you should question that a little bit more. Right. Especially with like the PT side of things. If you've done things over and over again and you're still getting the same result and you're like, I'm frustrated, I don't know what to do. Well, maybe find somebody like you who's going to approach things way differently than anybody else, which is why you're able to get the results, which is why you're able to train such high level athletes, because, you know, and those are probably some of the hardest ones to train because the mindset and the stubbornness of it too, where a lot of people are like, I've always done it this way, so I don't want to change. And
you know what? I will 100% say with certainty, when I was over in Tokyo for the Olympics, my main role there was not to be the PT movement guy. Yeah. Right? Sure, I could handle some little nigs and wiggles as they come about. I think that's a technical term too, nigs and wiggles. We can handle some of the training stuff there. We can handle some of the pain management stuff there. Yeah. But quite honestly, my main role there, because of the chaotic nature of an Olympic Games amidst this COVID era where everybody's stressed to the nines with everything going on. And I'll tell you what, when I was there, the first 7 days were probably some of the most stressful days of my life for a whole myriad of reasons I'm not going to get into.
We talked about it before when I was sweating my balls.
Yeah. You should have used some antiperspirant there. Yeah, come on, doc. So my main role there was actually to be a rock for these athletes. Yeah. To help ground them. Yeah. To be somebody to listen to and to help them understand what was going on in the world around them, help them understand what's going on inside their bodies so that they could breathe. Breathe, right? And focus on what they came here to do. Yeah. So I could take those stressors away from them. And mind you, I had to cleanse myself when I came home because I took on all that energy.
Yeah, it's hard.
Literally all that energy, and then how to kind of remove it. And there's some different ways I do it with breath and movement side of things and everything like that. But that's why there's so much more to coaching and working with the human body than just the physical and just drugs, right? It's the holistic nature of it. It's working with the mind, working with the heart and the gut and the sex center. Like, those are all different areas of the body.
They're all very important.
Very, very important, especially the sex center. Yes. That's how we procreate, folks.
Pretty magical.
I mean, our main role here on
it works twice. So.
Well, you're technically fitter than I am, according to Darwin.
Fair enough.
Because you have 2 kids. So you've already passed on your genes twice.
Sorry for being better.
Yeah, well, there's some other things that I might take you on.
Fair enough.
Like bicep size.
Tape measure, please.
For biceps. Let me clarify that. Tape measure for biceps.
We just got flagged.
Yeah, we do. But yeah, so it is that idea of trying to get the athletes or the individual out of their own head. Because that's where we do like that, a lot of that overthinking, that paralysis by analysis type of stuff, where there are other areas of our body, like our heart, like our solar plexus, our diaphragm, our gut. I kind of put all that in one, and then our sex center. Yeah. And if you can learn to listen to those different areas, I teach athletes to do this all the time, where we can close our eyes and those areas will tell you whether this is a good decision or not. Yeah. Right? Expansiveness, lightness are kind of areas where this is like a full yes, or constricted tightness is probably going to be a no, instead of kind of coming up here to the head where we could over rationalize and validate our own thoughts.
User education that sometimes is against us.
All the time. Yeah. All the time. So I feel like if I get anxious about something, my heart rate goes up. I'm like, I need to sit, I need to breathe, so that way I'm going to make the wrong decision here.
Well, I think because you play guitar. So when you brought that example up, I immediately thought it's like tuning a guitar. So each string has a certain note that it's supposed to hit. So when you're in tune with that, go figure, in tune, you hit the note and you're like, oh, that, like, because I've got an ear, and if something's off, I'm like, please tune that. So you tune it and like, okay, that one's good. And then you go up to the next one and you hit that one. And like, just needs a little tweak here. But when you play them all together, they form harmoniously. They perform harmoniously. So Same thing happens in the body. And the more in tune you can be, we can be, you can be throughout this whole process, throughout life, throughout this experience that we have, the more we can enjoy, the more we can experience, the more we can love, laugh, and do all the other and dance. I think is the other cliche thing. Dance,
Sure. Yeah.
dance like nobody's watching
Yes.
or something.
Sing in the shower.
Yeah, why not? Right? It's like, and it's such a beautiful thing. And life is designed to be beautiful. It's not designed to be lived in fear. And so when you're able to stack like the crazy weird stuff that I do, and then you're able to stack like the crazy awesome stuff that you do over here, like it does make. I think I termed it when we first like the alpha athlete, like the alpha human. Like it makes you so in tune with your body, you're healthy, you're functioning, you're fluid, you have an amazing relationships. Like you can add in like the sexual coach as well. Yeah. And you're able to tap into all of those centers and really be able to invest into yourself so you can have the best version of life you've ever had. I don't know if
I think that's it. That's a beautiful way to kind of encapsulate everything that we just talked about here today.
So if we're going to encapsulate that, how can or where can people find you, reach out to you? How do they get a hold of you?
You want me to get my cell phone number out here? That's probably a no-no.
The digits?
Yeah.
I mean, if you want to.
Slide into my DMs is probably the best one here.
Fair enough.
Yeah. So at Rooted in Movement on Instagram is an Instagram handle, and movement is an acronym. That's MVMNT as well. You can also reach me on email, Matthew@rootedinmovement.com or rootedinmovement.com, the website. Lots of goodies on there. I also have my own podcast that we'll have to have you on now and do like a round 2 of this.
Yeah.
And then I also offer a bunch of different courses and remote coaching, remote health coaching, and in person if you are here in Phoenix or Scottsdale.
Yeah. And you work with patients as well as other docs.
Absolutely.
Like with training.
Yeah.
So just to make sure we're clear with that, you kind of hit everything. Yeah. So, and I know Danny and Bree they'll put everything in the show notes and stuff for us because the good in media is awesome. Shameless plug.
There it is.
Right. So we'll end that with that here today. But I appreciate you being on here, brother. Fun. Yeah. We're going to do this again.
Absolutely.
For sure.
More ball jokes next time.
Fair. And bigger biceps. Bigger biceps, bigger balls.
So we do this again in 8 weeks. I'll make
bulk session?
Yep.
Okay.
Bulk session, 8
Fair
weeks.
Enough. Yeah. Game on.